This is Dr.Jhonsey, a psychologist from Aster Hospital and one of our branches at Suraksha Hospital, Kompally. Today we are going to discuss about depression. Depression is a mood disorder that causes a persistent feeling of sadness or loss of interest that characterizes major depression. It can lead to a range of behavioral, emotional, cognitive and physical symptoms. It affects how you feel, think and behave. It can lead to a variety of emotional and physical problems. Feeling of sadness, tearfulness, emptiness or hopelessness, anger, outburst, all these things are there. And then loss of interest is another major symptoms which we normally see in patients, and normally they are not able to enjoy what they normally want to enjoy or they will enjoy. Then a lot of sleep disturbances are found in these depressive patients. Tiredness or fatigue, anxiety, agitation and restlessness. These are the things what we have seen in patients who come. The slowness of thinking and slowness of body movement is also seen in the patients. The feeling of worthlessness is seen in the patients, and then they have a lot of loneliness feeling or guilt, and they feel that their life is of no use, and mostly they feel that this is not helping them to be the part of their life. And then they have trouble thinking, or let's say cognitive problems. Let's say they are not able to concentrate in their life, and they are not able to concentrate to the pattern of the thinking what they actually mean to, or they have it. And then they have something like unexplained physical problems like a chronic headache or a back pain or neck pain, which there won't be any physical symptom, but they feel that there's a lot of pain and the problems there. We see a lot of patients of depression in a day-to-day life, and a lot of patients who are coming from the corporate backgrounds or coming from a normal background or IT industry or children who are studying and all, most of the people complain with. But in psychology, we have seen that it mostly starts with the teenage, which we are very much concerned about, because in the time of adolescence, these are the problems start, and most of us don't even give that actually what has supposed to be given. For example, if a lot of people who suffers with some gastric problem or some another fever or something, we take them to a doctor. But if they say that I'm feeling sad or I'm feeling lonely or they say that you have to manage your life, and this is how you can be managed. This is how it has been said. So like if you see these things, you can strongly feel that the mindset toward the psychology or mental health is very rare or very less compared to other physical illnesses. So if we change our mindset towards it, that we can change completely, because if it is addressed in the adolescent time, or if it addressed in that time of teenage, most of the problem can be recovered, or most of the problem can be tackled, because most of the time we are not giving that kind of importance supposed to be given to the time of teenage. And now modern medicine has changed, and modern medicine is helping a lot to patients to address the details, symptoms of depression in such a way that it can be treated, and it can be treated mostly without much of a disturbances in their life. A lot of people who have taken medications or other psychological therapies and doing a very good job in their life. And if you see these things, like a lot of people, they complain of depression. Actually that is not depression. It has to be clinically defined. Every depression or every sadness or every lack of interest, not having sleep, appetite is not depression. Clinical depression definition is different. So for that, the DSM-4 or 5 revised is also there, which can be given to the which can be used by a patient to understand exactly where is the problem, what is the problem they have facing it and all. But being a psychologist, I will suggest that if the lifestyle of the patient is managed, and then they get that training from the point of view of relaxation therapy, this also helps in the patient's management of the changes whatever happens in the brain, and the cognitive behavior therapy, or the fantastic therapy which has been used widely worldwide therapy it is. And if it is done through a proper channel or a proper way, most of the depressive symptoms and most of the depression problems can be taken care with the help of psychological therapies or inputs. Because most of the time we are seeing the patient just believe in medication, but if it works parallelly, the psychiatry and psychiatrist work parallelly, the patient will benefit more compared to only one side. But in most of the cases, it is not required that you should visit a psychiatrist only. It is without medication also things can be taken care of, and a patient can lead a good life. Normally in our clinic we don't call patients because we don't believe any patient before diagnosed or before defining the symptoms it is a patient. So anyone and everyone can visit a psychologist, because to understand what is the exact problem they have. It's not that they should have a problem and then they should visit. It is like a symptom check, like what we normally do a diagnosis for a blood check or a BP check. Like that we can visit a psychologist, talk to them, and then they can help us in checking what exactly has to be done. So that way we can take care of the depression problems and all. In WHO standard says that it is 1 in 10 people are having depression in India, and 1 in 10 is a big number. So that which we have to address this problem, and without addressing this problem there are a lot of other things which is going to fall into place and which is going to disturb us a lot. So that's why we have to be so understanding towards the patients, so that they can understand their problem as well as the problem occurs because of the symptoms of the depression. So that is how we need to understand the complete terminology of it. Is not depression, it is a clinical depression which has to be treated, with medication. Other things can be treated without medication as well, the problems and the symptoms of. This is how it is.